Hello to all. Today I am going to discuss with you the entity called male erectile dysfunction. Male erectile dysfunction is a common problem affecting in all age group. In I think around 20 to 30% of urology OPD is of male erectile dysfunction patients are coming. That's a good sign. Earlier days people were very hesitant to discuss, but now they have come out and discussing the problems. It's very important to know what is the cause of male erectile dysfunction. For that we should know the mechanism of male erectile dysfunction. One important cause for the erection is the blood flow to the male organ, that is penis. When the blood flow to the penis decreases, it causes erectile dysfunction in majority of the cases, though other causes are there. So, the conditions like uncontrolled diabetes, hypertension, hypercholesteremia, hyperuricemia, all these things are contributing to erectile dysfunction. And you should understand that it is a vascular pathology. So, the people who are having erectile dysfunction, in coming days they are likely to have the same issues to the heart also, which can lead to cardiac issues or stroke. So, erectile dysfunction is a problem which has to be discussed with the doctor. The cause should be evaluated, and even a cross consultation with the physician and cardiologist must be taken so that all the diseases can be picked up in early stages and treated medically. Other causes are neurological damage, Peyronie's disease, ischemic priapism, trauma after spinal cord injury. There are several causes. So, we have to identify cause, treat the cause with the medications and find a solution for the erectile problem. Usually, erectile dysfunction responds to medications like most of the people will be aware of it, like sildenafil, tadalafil, dapaoxetine, etc. and many combination drugs are available. Also, exercises are available. Once these are not working out, then other causes should be sought out, like hormonal problem. There may be testosterone deficiency or thyroid issues which can contributing to erectile dysfunction. So, supplementation with this hormone may be needed. Some patients may respond. There are several section of patients will not be responding to this treatment. Then we go for higher investigations like Doppler ultrasound of the penis, and also we can do the papaverine induced penile erection and see the response and decide the treatment, and may opt for other non-invasive methods like vacuum pump, and it is very satisfactory to the patients. But all these modalities may again will be a failure. Patient may not be happy and still erectile dysfunction continues. Then we have to find a final solution, that is gold standard procedure is that penile prosthesis surgery. Penile prosthesis surgery, I will explain little bit in detail. There are two types of penile prosthesis or implants are there. We are using the Rigicon. Rigicon is FDA approved and US made, and important thing is that 4-layered and hydrophilic coated, which is very infection resistant one. And the company is offering a replacement warranty even for infection, and it's a lifelong guarantee. So, what are the type of implants we have? One is two-piece implant. Two-piece implant, it will be two rods will be there, that to different size is available, and it is implanted to the penis in a surgery of duration of 30 minutes. Important thing is that to do this surgery, there should be a high sterility will be there. As we are doing the transplant surgery in our center very regularly, we do the penile prosthesis also with the same precautions in the transplant theatre only, so that infection rate is very limited. And in the two-piece, it's hardly a 2 days inpatient, and patient can get discharged, and within 6 weeks he can resume the natural sexual activity. The next option is the 3-piece implant. This is a very ultimate, I will say the ultimate invention, I think, because it will have a 2 cylinders to the penis, a reservoir and a pump which is hidden in the scrotum. It will not be seen, even a partner cannot identify that the person has undergone the surgery. So comfortable and cosmetic it is. In the 3-piece implant, the thing is that whenever the person wants to go have a sex with his partner, he can have the small press in the scrotum where the pump is there, it is located, the erection will happen instantaneously. So what happened, it almost mimics like a natural erection, and he can, after the intercourse, when the button is pressed in the scrotum for the pump, it gets deflated. So it's almost like a natural erection. In the earlier one which I had told, in the 2-piece, it will be highly bendable, flexible rod technology, rods are placed, so that in the Rigicon, most flexibility is there, but penis will be always little bit bigger, as implant is not always get in the inflatable position. But it is a very highly bendable, no issue. 70 to 90% of the patients are satisfied with the first procedure which I was telling, the 2-piece implant. In 3-piece implant, more than 90 to 95% are happy, because in 3-piece implant, it's almost mimic the natural erection. All the important things we have to know is that infection is one of the most important thing to be watched on after this surgery, so that proper antibiotics should be given. First of all, sterile theatre, sterile equipments and everything should be very high-tech theatre, antibiotics, and proper follow-up is needed. In the 3-piece implant, the patient may need a close follow-up for 1 week after the surgery, because the patient should have educated how to use the pump. In both the 2-piece and 3-piece, the patient has to refrain from all sexual activity for 6 weeks, and after that he can have the normal sexual activity. We advise them not to go for a gym or heavy weighting lift or swimming pool, common people sharing, for at least for 6 weeks to prevent the infection to the implant. In short, penile implant is highly reliable, it's invisible, and almost mimic a natural sexual activity. If you have any doubts or anything regarding the penile processes, any queries, you can communicate with us. We are ready to help you out in this. Thank you.